Dave Campbell's Texas Football is proud to partner with our friends at Children's Health Andrews Institute to shine a spotlight on deserving student trainers for across the state of Texas. And here to talk a little bit about the partnership and what he does, we're joined by the Chief of Orthopedics at Children's Health Andrews Institute, Dr. Dustin Loveland. Dr. Loveland, thanks for your time.
Thank you.
Can you tell us a little bit about yourself and how you came to be involved with Children's Health Andrews Institute?
Yeah, I mean, not to go too far back, but I grew up here in Dallas. Went to Rowlett High School, played football for Rowlett, so kind of grew up on the sidelines of Texas high school football, and moved away for a bit to Miami, Florida to train in orthopedics. And on my way back to Dallas, did a sports medicine fellowship, so an extra year of training with Dr. James Andrews, who at the time in Pensacola Beach, Florida. And so a year of sports medicine specialization, kind of a wild year of pro athletes and colleges and planes, and not real life for most of us. But a great year nonetheless, kind of learning how to manage these injuries, learn how to, probably also more importantly, how to treat that type of patient, and enables us to kind of have that concierge type treatment that a pro or high level college athlete would get, and kind of tailor that to our youth, all the way from surgeries down to rehabilitation, performance training, nutrition, and all that. So it's kind of a cool concept that we have here. I was in fellowship, so I was in my year of specialty training when some of the visionaries at Children's Health kind of just had a little bit of a wild idea and said, "Hey, what if we got James Andrews to do something here with kids?" And it kind of sounded a little crazy at first. Fortunately for me, I wanted to move back to Dallas, and at the time it was happening, I was with Dr. Andrews, and he was having these meetings with Children's Health, and kind of inked a deal to do something a little outside the box for him and for a lot of children's hospitals. And so fortunately, right place, right time. He's the type of guy that just sort of tells you where you're headed. And fortunately, it was we need you here in Dallas, and worked out perfectly. The other thing that was nice is we've had this hospital in Plano for about 15 years. That's very nice, and full functioning operating suites, and it's a beautiful hospital. But it was always in the plans to build our own standalone building. So we have a specialty center that's on the Children's Health Plano campus. But essentially we were able to really build it from the ground up, from our clinic space to our massive physical therapy gym. Adjacent is Exos, which is also traditionally known for training college and pro athletes in the off season and getting ready for the draft and combine. They were also willing to cater towards youth athletes too. So, and fortunately, we also have a partnership through Children's Health, so the us aging athletes have access to it as well. So, really, in terms of selfishly, a dream come true, enables me to take care of young athletes. And one of the beautiful things about Children's Health is pretty much take any insurance and no insurance, and it's nice to not have to worry about the healthcare system and who gets access to what type of care and all that. So it's really a good setup. So long-winded way to say I grew up here. I love Texas high school football. I feel at home on the sidelines, and I'm very blessed to be able to continue to do it in what's now my hometown of Prosper, Texas.
Well, and you mentioned, you feel at home on the sidelines. You spending Friday nights on sidelines. You're the team physician for the Prosper Eagles, state ranked, I should mention, by Dave Campbell's Texas Football. What do you do with them? Can you tell folks about what your role with them, and then just how important really it is for high school teams to have somebody like you on their sideline?
Yeah, I mean, I think the most important part is having someone skilled in an emergency action plan. Like, we're there, diagnosing, treating sports medicine injuries, but I think really the most important thing, and is having a team from athletic trainers, student athletic trainers, orthopedic surgeon, sometimes a non-surgical physician, EMTs on standby. It's really, the real importance is being able to prevent something catastrophic. Kind of my day-to-day role is really just communicating with the head athletic trainer there regarding injuries that happen during the week as well as afterwards. Just for instance, we had, it's barely 9 a.m. We've already had a conversation and kind of gone through the injury list for this upcoming second round playoff game. We have MRIs that I have to review and kind of get back with the family and athletic trainer about. So a lot of work that goes on behind the scenes. From a game standpoint, it's the routine is mostly meeting the opposite team athletic trainers. Hopefully they have a team physician as well. It's an embarrassment of riches sometimes up in Prosper. We do have x-ray machine on site. So it's nice for a home game to let the other team know that if you do need an x-ray, we do have that capability. During the game, it's mostly patrolling the sidelines. And when you're blessed with a skilled athletic training and student athletic training group like we are, I'm there, eyes on the field, but I'm mostly enjoying the football game. If someone goes down with a cramp, a ankle sprain or something, I'm usually not involved. I don't run out there. I let them do their thing, and they'll give me a wave over if they need me. Sometimes at our previous game, we had a broken leg 165 seconds into the game. So we had a little drama there, but it's impressive to see the EMTs at work, the athletic trainers, the opposing team athletic trainers. Just nice to see everyone work as a team and get everything taken care of in a timely manner, get the kid off to the hospital in that situation. We also have are fortunate enough at most of our Prosper and Frisco ISD games to have a trained concussion specialist, usually a PhD neuropsychologist there too. And, I kind of, I'd say grew up, but learning how to be a sideline physician, we're usually in rural communities where you're lucky if you have an athletic trainer at all. Usually no student athletic trainers. But it's a good learning experience because in the small schools, you're the one stretching them. Heck, you might be grabbing a bottle of water to take to the refs and pretty involved. But in these bigger, Texas 6A schools, it's the setup is more impressive than most Division II colleges.
You mentioned the student trainers. I know Dave Campbell's Texas Football is a great partnership with Children's Health Andrews Institute, focused on spotlighting student trainers in North Texas who work hard to keep athletes safe and healthy. From your perspective, just how integral is the role that student trainers play in just the day-to-day operations of a football team?
Yeah, I mean, a high school is lucky to have 3 athletic trainers, not student athletic trainers, but athletic trainers. And I'd say most 5A, 6A schools will have 2. If you're just talking about football, those 2 will be pretty busy in any given practice, especially in a game. It's pretty critical to have the student athletic trainers because even something as simple as an abrasion with a little bit of blood, or especially a drop of blood on the jersey, it's just for safety reasons, that player comes out and has to get his wound dressed, his jersey cleaned before they can come back in. Hydration is important. Like I said earlier, to the referees and obviously the team, you just need more bodies and you need more trained students to do it. Fortunately, it's a pretty fun gig. I actually did it strangely played football my freshman year of high school and was an athletic trainer too, obviously not at the exact same time, but so I had some experience in it. And it's fortunately up here a lot of the students are interested in healthcare, and it's a great way to get exposed to injuries, first aid, CPR, emergency action plans, and but just having people. I mean, if you just think, the things we worry about, head or neck injury that requires backboarding, here you have, lifting a 250, 300-pound athlete onto a backboard with pads on. I mean, you need trained people that are ready to work, which is why I run through these simulations and drills. And it's just not going to happen with you might have enough players and coaches to help, but none of those have been trained like these student athletic trainers have. So they're essential to any practice or game specifically.
And finally, we've talked a lot about Children's Health Andrews Institute, and people may know the name. People may have even, read a little bit about it. What's something that maybe parents or coaches should know about that maybe they don't know already?
Probably two things. One is access. You can, my front desk may kill me for saying this, but you can literally just drive up and come in. This isn't like your dad's orthopedic surgeon where you call and they're booked through, the next available's mid-January. You got to wait 2-3 months to get in and hope you can get off work that day. We're fast, we're efficient. We usually see over 200 kids a day, especially on a Monday, picking up injuries from the weekend. And so that, we're seeing 200, that 201st and 202nd kid that got injured, it's nothing to us. We'll get you in, we'll get you seen. We do have a fracture clinic that if a kid breaks their arm, they can come in without an appointment. And the moral of the story is if you get your kid here, we're going to see him, we're going to take care of them. Because of most of our patients are student age, adolescents, we do have an injury clinic that's open past 6:30 essentially. So you don't have to even miss school or work to bring your kid in. The other thing is, we try to get people in the door to see what we have here. It's impressive. I mean, if Greg, if you hadn't been, it's a sight to behold that our kids have access to this. The level of physical therapy, our head physical therapist was the lead physical therapist with Dr. Andrews. I mean, our lead physical therapist has been taking care of Major League Baseball Tommy John injuries and National Football League ACLs, for his whole career, and brings that knowledge here and trains our younger physical therapists to do that. The football field we have here makes my job so easy that, it's hard to tell someone when they can return from a bad ankle sprain in a office. It's who knows what they look like when they're out there, but it's very easy to say, here's one of my PTs. Why don't you go run out on the field? We'll run you through some drills. You're a quarterback. Well, here's a football. We're going to, run you through your progressions and have someone skilled watching you do that and see if it's safe to go back. Our concussion program, we have 5 days a week, full clinics, which is, I don't know, sad, impressive. I don't know what it is, but we have a whole team of neuropsychologists and concussion doctors that are busy 5 days a week. It's just we're here to help people. We all love sports. We all love getting your kid back to sports. So it's when something bad happens, it's a pretty nice luxury to have in North Texas to take care of your kid.
He's Dr. Dustin Loveland. He is the chief of orthopedics for Children's Health Andrews Institute. Dr. Loveland, we sure appreciate your time.
Appreciate you, Greg.